But thank you for joining us. This is our third teach-in session. We first started with a legislative bill update earlier. Last month, we did voter registration and best practices and talked a little bit about municipal elections. And tonight, we're going to talk about the budget effects on our communities. So this partnership with the NAACP Political Action Committee Empower the Vote, Mr. Orlando Roberts is here with us, and Democracy North Carolina. So we're going to jump right in, and let me introduce you to Maria Lopez Gonzalez, the public policy advocate at the North Carolina Budget and Tax Center. And you know, they're a nonpartisan, nonprofit organization, does some excellent work. And I know you're going to enjoy this presentation from her. And we're going to jump right in without further ado. I'm going to turn it right over to you, Maria. And anything else you want to tell them about yourself, please feel free to do so.
Thank you so much. I'm really excited to be here with y'all tonight. I'm going to be talking about, as you might know, right now we're in the middle of budget negotiations at all levels of government, local, state, and federal. I'll be talking today specifically about the federal budget proposal so far, but I'll make several connections to our state budget. But in the chat, as I introduce myself, I'd love to hear people put, your name, your community, where you're coming from, and whether or how federal cuts have impacted you or your community, why federal funding is important to you. Like Linda said, I'm Maria. I use she, her pronouns. I'm the public policy advocate at the North Carolina Budget and Tax Center. And so I do a lot of work with our team to track, to analyze the different policies being introduced, do a lot of work in trying to understand it and getting people connected to it directly, people that have been directly impacted by economic hardship, by the policies themselves, so that we can really build the systems in society that we want to see. For me, federal funding has been incredibly important to my family as well, because I grew up in a mixed status family. I have DACA. And so right now in this moment, it's especially, my life is pretty intertwined with the decisions they're making as they decide how much money to cut to programs that my siblings have depended on all their lives, such as Medicaid and SNAP. And how they use that money to fund a deportation machine and tax cuts for the rich. And so I know very personally the impact and the importance of this moment and of these policies. Like Linda said, we're the North Carolina Budget and Tax Center. We are a nonprofit. We are nonpartisan. We work to document, to analyze fiscal and economic conditions of in partnership with community leaders such as Democracy NC, such as yourself, other North Carolinians. And we like to start off on a very proactive, visionary note and to think about what is possible instead of just what is happening and the negatives and the awful impact, so that we can keep this vision, we can keep this as our North Star. And our vision is for North Carolina is a state where every person can reach their full potential, where we can achieve well-being through the support of trustworthy anti-racist institutions and systems that we all participate in building. Because imagine if our economy was measured by how healthy our communities are, how well off people, or how people are able to thrive and access resources, instead of just measured by how much labor we have, how much product we produce. And so we see a better future. So to get us started, the budget and policy choices that our elected officials make matter, because we know that they should represent the interests of the people, whether it's people that are voting for them, whether it's people that aren't voting for them. In general, these decisions impact everyone in North Carolina. And we know that one, people fuel the economy. The economy cannot exist without people themselves. Two, the funding the things that make people's lives better helps the economy and our communities move forward. But as we're seeing, when policymakers rig the rules for the wealthy few, we have to come together and demand better and hold our elected officials responsible. So I'm going to be talking about the federal ones. If at any point you have any questions, if there's anything I need to clarify or restate, explain differently, do let me know. And I'll take a moment to do that to the best of my ability. At the federal level, the federal decisions about what to fund, how to pay for it, do have a direct impact on the well-being of North Carolinians, our communities, future generations. Each year, federal funding to North Carolina is roughly equal to our entire state budget. And so, for example, I think it's 2024, North Carolina received about $34 billion from the federal government, over $30 billion from the federal government, and that's about how much our state budget is as well. The majority of this funding comes to the state in a couple of different ways. The majority comes to the state in the form of, goes directly to the state, local governments, for education, workforce development, childcare. There is also direct funding that goes to individuals through the form of SNAP benefits, Pell Grants, and so people applying directly to these benefits or to these grants. And then additional federal funding is sent to universities, nonprofits, public agencies who themselves also apply for grants from the federal government. And right now we're seeing through both the budget process, reconciliation, and other slashing of agencies' budgets that all of the routes that the federal government has to give money to North Carolina are being impacted, not just through the budget that I'll be talking about. And so to set the landscape, the money that gets sent to North Carolina from the federal government, the money that we receive, they have important significance to the people. Across North Carolina today, 1.4 million households have food on the table because of SNAP. That's food assistance. 650,000 North Carolinians have health coverage because of Medicaid expansion. And North Carolina fought for a very long time for Medicaid expansion, and now that's at risk. 408,000 children receive meals at schools for no cost. And so this one especially, children should be able to have a meal, have access to a meal, and we're cutting the funding that goes to their free school lunches. Retailers and healthcare providers receive critical revenue from SNAP and Medicaid. So it's not just the people themselves directly that are receiving the SNAP benefits or the Medicaid, it's the retailers and healthcare providers that also benefit, because it means that they don't have to cover costs when someone shows up to their clinic, to their hospital, and can't afford to pay out of pocket. They get this money through Medicaid and through the health insurance. And so without it, they either have to pick up the cost or they have to deny service. Right now, the cuts, so all of these cuts, they're going to do three big things. One, they're going to hurt people's well-being. So that's their health, their safety, their security, their mental, emotional well-being as well. It's going to shift costs to the state that I'll talk about in a second, and it's going to block economic progress, because we know that when people aren't financially stable, when they're unsure, they want either, it means that they don't have the money to spend, and so that's money that's not getting circulated in our local economy. That's money that's not getting spent in our local businesses. That's money that they're not able to pay their bills with. And so then service agencies, departments, they're not able to receive that funding. They start saving money if they do have it because they're preparing for something. And again, that's money that's not getting circulated. And our local economies are really what allow us to have economic progress. And so these big three things are going to happen. This map specifically, in talking about how people's well-being is going to be impacted, people will get sicker. This graph shows the impact to the state just from one of the proposed Medicaid cuts, and that's the creation of new work reporting requirements, the changes to the work requirements. These requirements are intended to take away health insurance from people who have been but they have been proven to do nothing to improve employment outcomes in general. Over nearly 496,000 people could be at risk statewide of having their health care taken away under this provision, just this provision. And so you'll see that the darker the color, the more people will be impacted. In rural areas, especially, the impact is harder, and we know that they already face bigger obstacles in accessing healthcare, whether it's lack of transportation, whether it's how far they have to drive, take time off of work, lack of funding. $1 in $3 of healthcare 1 in 3 healthcare dollars nationwide comes from Medicaid. And so this is a huge cut to the state. People will be hungrier. 1.4 million North Carolinians receive or participate in the SNAP program, and they get about a modest $6 a day per person in help putting food on the table. Just $6 a day from SNAP benefits. So it's not even this huge benefit that they're receiving. In the map, you'll see that the work reporting requirement changes that they're making alone would put about 375,000 people at risk of losing food assistance. This is specifically targeting North Carolinians that are aged 54 to 65, parents of young children who would be newly required to report their work hours. And so these are parents who may not be able to go to work because they can't afford the childcare. Childcare is ridiculously expensive. And so, and now they're giving them work requirements. And typically the people that don't work and that aren't able to meet these work requirements, it's because of systemic reasons. People usually want to work. They want to be able to afford their basic needs, right? This is not a crazy concept, but due to systemic, all kinds of barriers, too few hours. Usually they work in situations, in precarious work situations. And so, for example, they might not be able to get more hours at their job. I know my mom deals with that all the time, where she wants more hours, she needs more hours, but her employer can't afford to pay her the extra hours. And because she lives in a rural town, she's not able to just go apply somewhere else. The employment opportunities are limited. Sometimes people who, for example, if they're working in the food industry, they have inconsistent schedules and cannot meet these work requirements either. There's less access to transportation, to internet. You need internet to be able to apply to jobs, to do a lot of these jobs nowadays. And so there's just so many obstacles that people face in accessing work itself that lawmakers are either not taking into consideration or they're choosing to ignore. And the last one is the cost shift to North Carolina. It's going to make it just so unaffordable for our state. They're forcing, so for example, North Carolina, $584 million in new costs to cover food assistance, a potential $4 billion extra dollars in new costs for Medicaid, and the new costs for administration of Medicaid and SNAP. And so, like I mentioned earlier on, North Carolina's budget is roughly equivalent to the money that the federal government sends us. And so what they're doing at the federal level is that they're manipulating the narrative to say, we are not cutting benefits. We're not going to cut Medicaid. We're not going to cut SNAP. Your state is just going to pay for it. Your state has a responsibility to pay for it, and they're going to pass it to the state. However, in North Carolina, what we're seeing, what we're expecting now is that we don't even have the money. We won't have the money to afford our own budget. We're facing a revenue cliff in the upcoming years because of tax cuts that the state government has been giving to corporations. And so I'm going to put in the chat, I'll put throughout the presentation several resources, fact sheets, and just reports that we've written to give more context for this. So this one specific covers the upcoming revenue decline. And so North Carolina won't be able to afford, it's half of our budget. We won't be able to afford this if we don't make changes. Slide. Okay, so this is this graph specifically. So like I said, there's going to be huge cuts to SNAP, huge cuts to Medicaid. And what we found in this analysis is that that amount of cuts that they're making to both SNAP and Medicaid is basically equal to the amount of tax cuts that they're giving to the top 1%. And so they're using this, they're cutting these benefits to be able to move that money and give it to the top 1%. They want to extend tax cuts that are set to expire at the end of the year. And so to put it in further perspective, the average tax cut for millionaires, oh wait, hold on. No. Yeah, the average tax cut that millionaires will receive is roughly 1,000 times the tax cut that the lowest income households will receive. And that's what we see in this graph. These tax cuts, another thing that they're doing with the narrative, like I mentioned, is that they're saying these tax cuts are for everyone. These tax cuts are going to benefit everyone. But what we found in this analysis is that the majority of that will go to the richest 1%. And it's a huge difference from even the next 4%. The bottom 20%, there will only be an $80 difference on average, an $80 difference in their taxes at the end of the year. And so this talking point that they have that it's for everyone. Everyone wants tax cuts, but we see that that's not the case. So that's the federal context. At the state level, to add more to it, we've had about a decade of state level tax cuts and legislators scheduling into the future more tax cuts, including the elimination of the corporate income tax. And so by 2030, corporations are just going to completely not have to pay state income taxes anymore. And so these new costs that are going to come from the federal level will mean that just North Carolina won't be able to afford it. They're either going to have to cut services from the programs themselves or look for cuts in other areas. And we also know that they're severely underfunding things that North Carolina already needs, like public schools, elections. And so they're going to either have to cut the services or cut money from somewhere else to be able to afford this cost shift. But there are options that they have. One, we know that they can pause these scheduled income tax cuts. They can pause the corporate income tax cut, or they can raise taxes on incomes over $1 million. They can implement a wealth tax like we've seen across the country happening. And taxes are not a bad thing. Taxes have only become this evil thing because people can't afford their basic needs, much less to pay more in taxes. But when the state uses that money responsibly and funds the things that people need, we won't need tax cuts in the future. We won't need that extra because the government is already funding the programs that sustain our economy, that sustain our communities. And so this is the first action alert that we have. It's a lot of information, but we do have this petition going on. We have been working really closely with state lawmakers to give them more information about these cuts, about options that we have. And the main action we have going on is asking them to pause the corporate tax cuts, to keep it at its current rate, which is, I think, 2.25%. And that's already the lowest in the country out of all the states that tax corporations. We have the lowest rate as is. And so the ask is that they just pause it and keep it at its current rate. If you're able to scan the QR code, that's amazing, and sign the petition. Otherwise, you can find it at the link, ncbudget.org/choose communities. And we can put that in there. Oh, perfect.
I also dropped it in the chat.
Thank you. Cool. All right. So that's a lot of, setting the stage. I'm going to now go into more of the specifics. And one thing to note is that the specifics I have covers just the House reconciliation version. So the thing that you've been seeing on the news that they call the big, beautiful bill, that's what I'm going to be talking about, which is separate from the actual appropriations that the federal government makes. And so there's a couple of different things that they're doing. But this is just one portion of it. And currently, in this moment, they're doing the Senate version of it. And so this is not the final version. This is not the actual cuts that are going to likely happen. There might be tweaks, there might be changes based on what the Senate negotiates. But you can always follow our website or different resources that I'll put so that you can get the final version once it comes out. Okay, so some of the specifics. One, this big, beautiful bill, the House Reconciliation Bill, it's going to make accessing higher education more difficult by doing a couple of different things. It would drive up the cost of student loans. It would reduce the level of Pell Education grants for college students. It would change eligibility rules for Pell Grant recipients. So for example, they would change the definition of full-time enrollment to be higher the number of hours that they're enrolled, or it would fully eliminate it for students enrolled less than half time. And so right now, people can still access Pell Grants even if they're enrolled less than half time. And so they're increasing the requirement. They're increasing the number of hours students have to be enrolled. And so the students that are going to be the hardest are students that just don't have the time, don't have the opportunity to be in school longer hours. Many college students already have to work long hours just to be able to afford their tuition, or they have children, or they live in rural areas and they commute to school. And so they're just going to be unable to enroll in additional coursework or need to take on additional student loans to make up for that lost grant funding. This bill would also exclude children from benefiting from the child tax credit expansion because their families' incomes are too low. 27% of North Carolina's kids are already excluded under the current child tax credit policy. And so currently the child tax credit is about $2,000. This bill is going to expand it to $2,500, which is a great thing. However, families whose incomes are too low won't qualify for it. And so the families that need it the most won't be able to benefit from this child tax credit. And this doesn't, yeah. And it would also deny kids whose parents, it would make it where in order for a child to benefit, both of their parents have to be US citizens. So if at least one of their parents is not a US citizen, they won't qualify for the child tax credit either. And the child tax credit has been proven time and time again to reduce child poverty. In North Carolina, the child poverty rate tends to always be higher than the general poverty rate. And so we're cutting one of the most important programs in reducing child poverty in the state. The last big piece of the bill is that it's also cutting climate and energy funding tax credits and just other programs that are designed to promote clean energy. And so this would raise households' energy costs. It would undermine a lot of the economic opportunity that the state has been able to take. It would hasten climate change. And we know that people with low incomes and people of color are already the most burdened by climate change. They're already the most impacted. So they would be disproportionately harmed. To talk about Medicaid, the biggest cuts in this bill will hit Medicaid. So it's doing several different things in order to find the money. One, it would take away Medicaid coverage from people not meeting a work requirement, which I had already talked about. It adds new barriers to eligibility and new enrollment processes, new rules, just a different process altogether. And a lot of the people who are responsible for processing these applications, they won't have enough time. There's going to be a backlog. They're going to have to just deal with all these new changes to both Medicaid and the ACA marketplace. It's going to take coverage away from immigrants who are living lawfully in the US. So I'll talk about a little bit more about how this impacts immigration in a second. It's going to add new out-of-pocket costs for a lot of people that have Medicaid and who are enrolled through the ACA marketplace. And so for the first time, they'll have either a copay or some out-of-pocket costs. And it's going to fail to stop the premium spikes for the ACA marketplace enrollees. And so people that have healthcare through the marketplace, there's a premium tax credit that they get. However, it's going to remove that. And so people's insurance is going to go up, the cost of their insurance. And this, again, doesn't just impact the households that receive the Medicaid. This will impact everyone. When people get their healthcare taken away, they don't visit providers, they don't access healthcare at all. And this means a loss of revenue for the actual providers themselves. And that's particularly true in rural parts of the state where their hospitals are already underfunded, where they're at risk of closure, where they have primary care deserts, places where there's just not enough providers for the population. And if they have less people coming, less money coming through Medicaid or just health insurance in general, they're going to find themselves forced to close. It's going to impact their ability to pay their employees. It's going to impact their ability to be in that region, in that area. They might have to move. And so it's going to just send a shockwave through the whole community. And so continuing down education. They're jeopardizing health for an anti-immigrant agenda as well. I mentioned that the cost of the cuts to Medicaid and SNAP equal the amount of cuts that they're giving to the rich. However, some of the harshest and most cruel pieces of it is also intended to target immigrants, refugees, people granted asylum, and victims of human trafficking, people who have had to prove to judges, to lawyers that they have faced persecution in their home countries or that they have been victimized by sex or labor traffickers. They're among those who would see their food assistance taken away, Medicare, all the Medicare benefits that they've paid into, Social Security benefits if they've paid into those through a work authorization, it's going to be terminated. Pregnant women, if a mother is undocumented but she's pregnant, she's able to still receive food assistance for her children who are US citizens. Those will be taken away, and they would also take away that child tax credit from US citizen children in immigrant families. But this puts at risk the wider healthcare system in North Carolina because North Carolina has done recently what more than 30 states have done, which is followed the federal law that allows them to legally residing immigrants, so those with humanitarian parole, to participate in Medicaid. However, if North Carolina, there's this new policy rule, if North Carolina does not end that coverage for them, the House bill would reduce the federal funding match for the expansion population for North Carolina, meaning that recently when they expanded Medicaid, the federal government was able to match funding. It was able to give them additional funding so that the state could afford this Medicaid expansion. However, now if North Carolina doesn't cut funding to these immigrants who are here lawfully, the federal government will just stop paying, will just stop giving that match for Medicaid expansion. So people who benefited from the expansion, they'll no longer have access to that healthcare. I got tripped up on my words, so I hope that made sense. And so one of the things that we're seeing with their narrative, to go back to that point, is that they're saying we're cutting health insurance for undocumented people, for people who are here illegally, and they just keep saying for illegals, but the policy itself, the way that they've written, it's only going to impact people that are here lawfully, that just aren't, unfortunately, US citizens yet. Okay. Ooh, that was a lot. Okay, for SNAP. This will slash federal funding for state SNAP programs. It'll, for some of the states, it just risks just ending it altogether. It takes food away from millions of people, especially families with school-age children. It ends food assistance also for people with a lawful immigration status, specifically ones that are based on humanitarian need, including about 50,000 children. So 50,000 children who are here with their parents due to humanitarian reasons. And it cuts food benefits by preventing SNAP from keeping pace with the cost of a healthy diet. And so SNAP usually the benefit is able to increase as the cost of a healthy diet increases, but this would just keep it. It also increases paperwork in order to prove other expenses. And it just, it makes the process so much more complicated. A change to the amount of food benefits a SNAP household would receive means that over the next few years, SNAP costs will be cut by an estimated $7 per family. And so food costs used to be adjusted only by inflation of like the basic consumption basket. And so this is like the basic things that make a healthy diet, but new places are now put in place in recognition that but new policies were put in place in recognition that the cost of healthy food is impacted by inflation differently. However, the US House would revert back to this old way of calculating, resulting in a reduction of SNAP coverage of the cost of food. And again, these cuts to SNAP benefits don't just impact the people that receive it, they impact the entire community. When people can't buy food, they don't visit local food retailers for whom in more than 1,400 in North Carolina, for more than 1,400 families in North Carolina, SNAP represents a major revenue. And so no, that's wrong, sorry. When people can't buy food, they won't visit local food retailers. And so about 1,400 food retailers in North Carolina, this is a major source of revenue for them. So think local farms that have a food partnership with schools, or farmers market that are able to, where people are able to go and pay using their SNAP benefits. They will no longer, that's a major source of revenue for them that they no longer will have. Without that revenue, some of those retailers will be forced to close. They'll have to lay off workers. It'll lead to greater job loss. And again, once people have job loss, we see that the wider local economy struggles. So again, when people aren't able to meet these basic needs, such as a roof over their head, food on their table, medical attention, their focus is no longer on how to be a full participating member of society. It's solely on survival. And so for this space, a democracy space, we see then, people's ability to be civically engaged, to go to vote, we see that getting impacted as well. It has these ripple effects, because people are not caring about who they're voting for if they don't have enough money to be able to feed their children, if they don't have the time to take off work because they have to now make up this lost income. So that's a lot. I feel myself getting riled up, but there is still an opportunity to take action. A lot of you probably have already been vocal about this, taken some kind of action, following it. This is the timeline right now that we're at. This past May, we saw the US House vote on this. We're currently in the Senate version of it. So the House created this version. The Senate is doing their own version. And they have different processes and rules. Once the Senate votes on their full one, and we expect their vote coming in the next 2 weeks, they leaders from both the House and the Senate, they get together, they meet behind closed doors to negotiate those differences, and then they make a final version. They have to vote on the same exact version, and so we expect that final one by July, mid-July, maybe end of July. They're trying to rush it through. But however, their actual deadline is December 31st to at least to extend these tax cuts that they want to extend. So that's the core of it. We do have this final action alert. This one contacts both your federal lawmakers and your state lawmakers. So it asks your federal lawmakers to vote against this, to oppose it, and it asks your state senators, your state lawmakers, to call those federal ones as well and say, hey, North Carolina can't afford this. North Carolina won't benefit from this. It's going to hurt us as our federal delegation. Please do something. So it reaches both of them if you have the opportunity to complete this action. Oh, and I didn't even put the different resources I had. So are there any questions? I'm going to put a couple additional resources. So this first one I'm putting is more context, more information about the history of tax choices in North Carolina. This one, the second one, goes deeper into the cost shift to North Carolina. And then this one, oh, no, did it wrong. This one covers everything I basically talked about, the impact to families through the various different cuts. So if you want to read it once this is over, digest it a little bit easier, that last resource provides that to you. And then, yeah, so I'll take any questions and then I'll share how you can stay connected with us.
Hey, that was a mouthful. I noticed you had to catch your breath a couple of times. So, any questions for Maria right now? That was a lot.
It's a lot, and it's intense, and it's sad, it's disgraceful, it's shameful, it's all the things.
Shameful. It is awful. Anyway, I want to say, does this apply to the whole United States of America? Because they're all immigrants, okay? Only two are not, you know. But
yeah,
it's awful. It is really awful. I just, it's unbelievable what's going on, and we're all already feeling it here in Winston-Salem, especially with our food banks. It is just, you know, you're talking about hungry families. We're in a lot of trouble, you know. So
and this doesn't even.
Go ahead.
Yeah, this doesn't even cover the tariffs that are being added. It doesn't cover the cuts to universities that they're doing. It doesn't cover all the other cuts that we're seeing through the other departments. This other resource that I put here, 2025 Economic County Snapshots. If you're interested, it's one of our biggest research projects. If you scroll all the way to the bottom, you're able to click through different counties and get an economic snapshot of where they're at just in their local economy, whether rent is affordable and for what percentage of renters, how accessible quality jobs there are, mental health rates, what the living income standard is. It's a great resource if you want to learn a little bit more about your county.
It is an excellent resource. I've used it time and time again, and I encourage all of you here. You're from various counties, not only here in the Triad, but I saw Cumberland County, Mecklenburg County. You all need to use that resource and learn more about your county. And the North Carolina Budget and Tax Center does such a good job. You need to follow them, along with Democracy North Carolina and the NAACP, but follow the North Carolina Budget and Tax Center and get all this great information. Because I read something in our newspaper here about the food bank, you know, how, you know, they serve so many people, 18 counties around this area. You know, a lot of food because of the U.S. Department of Agriculture's, you know, their elimination of this program. So
Mhm.
people are going to be feeling it on the ground. And even the emergency food assistance program, eliminating that. We're going to have to, if we're ever going to have to take care of each other and talk to our neighbors and pitch in and do something. If you don't do anything else, you need to go and vote. That's what I tell people. You need to
Mhm.
vote because your vote matters, and we see the results of
We're
our
seeing it.
vote. Yeah, and so not only we still have touched to a lot of nonprofit organizations and HBCUs and industries for the blind. I remember what really got me uh, so involved in politics and going to the General Assembly. I went to lobby one day and I saw all these little blind kids, holding on to each other in a line, crossing the street, going into the legislative building. And I said, wait, why are they going? Are they going to talk
Mhm.
just to get the experience? They were going to talk to them about not cutting funding for the blind, and that really touched me, you know. And I was like, no, I can't sit still while they continue to do this and treat people bad. So any questions for Maria? You have any last call to action for them? Besides, making sure you check out our websites, and we're going to be sending you out this presentation so you can digest it a little slower, and keep up with what's happening because it's going to affect our communities at all levels. Any
Yeah,
questions?
yeah, the last one, same one as Alicia just put. This covered just the federal budget proposal right
Right.
now. We do also have this alert that you sign up and you're able to receive text messages about the state budget updates.
Right.
And so if you want to get real-time updates about what's happening at the state level, you can get this one. You can sign up through this link.
Okay. Great, wonderful. And we can send you all those links if you not copying them right now, but we can send them, make sure you get them, with this presentation. So we don't have any other questions,
Or comments or stories even of how you're
comments.
impacted.
Yeah, if anybody have a good story they want to share, anything that's happening that you've heard in your community that's being affected or people are talking about. Nobody's feeling it yet. You
It's a
will.
lot. It's heavy also. I
Yeah,
get it.
it is very heavy. But once it takes effect and it really starts affecting your organizations, your governments, and your programs on the local level, on the ground, you'll understand clearly what we're talking about for sure, because it's going to affect a lot of people. So we rushed through that. I know that Queen, you're feeling it. I know you are in Cumberland County because we are here in Forsyth. You want to say a little bit more, Queen?
I belong to probably one of the largest churches here in Cumberland County. And we operate a food bank as well as Meals on Wheels. And the quick adaptation, we're still doing it, but on a smaller scale. And with that weekly threat that you may not be able to take food to folk who can't get out of their houses, and rely and depend upon on you, uh, because your church has been the folk that they had to, as should be, to get them their food. And um, so and just in a presentation yesterday, the man from I guess it's called a Southeastern Food Bank that covers the regional area. Matter of fact, he was making comments at a funeral, but in his comments talked about the impact that all of this is having on them serving 34 rural counties. And I think sometimes our lives can become so routine, and folk miss meals because they don't um, want one, or in my case, you don't want to cook one. Uh, but I'm feeling it at the grocery store. It's just a shame that I'm paying almost double um, what I had been paying last year for food, just for one person. And I don't have the traditional retirement that a lot of folk have, worked 40 years straight, that kind of stuff. That wasn't my path. Um, but on what I do have, I was doing okay. And then the threat of every month that, somebody may be jeopardizing your main source of income, which is for me, my Social Security.
Right.
And so
And they're playing around with that too.
pardon me?
They're playing around with Social Security too. So
Right. So not only the food, but your whole livelihood.
yeah,
Because the whole medical thing is attached to Social Security Department,
right.
And so I don't think people look at this, as a millennial said, systemically, uh, and that it's not those other people, it's not those poor people,
Right.
and not those marginalized folk, or not just,
Mhm.
it's anybody, whether you got a job, or you're retired, or you don't have a job. And I think Maria just did an excellent job in showing that it touches everybody.
That's right. That's right. Thank you
Uh,
so much, Queen. And I appreciate that. Thank
And
you.
I
Alicia, I think I saw your hand up.
Yes, that I wanted to share that my mom's a small business owner. She has a food truck that she runs basically by herself with the help of us at times, but she's feeling it as well. It's kind of a tricky place because it's like her costs are going up, but then we also don't want to raise our costs because we understand for other people to buy the food as well, it's expensive for them. So it's kind of that tricky spot of like, do I eat the cost as the business owner to try to keep my costs low so people still continue to buy from me, but then it's getting really expensive. Like some of her costs for food or having to travel to get food or try to figure out where's the best place to get food at a lower cost in bulk has been a challenge that we're seeing now, especially in the summertime with the new budget and things like that, with the food costs going up, even from the perspective of the businesses or local small businesses, like trying to feel for the people who are buying it, but at the same point is like we can't lower our costs and lose money ourselves as well.
And
Mhm.
it's local businesses that have always been just so, since you're so deeply rooted in the community, you look out for each other. Something that corporations like Walmart, Target, they have no shame in raising prices because they don't see that impact the way that the local business owners do, and they're not getting the benefits of those corporate tax cuts. So yeah, it's so hard. And
Yeah,
it's beautiful that I'm seeing so many people really like looking out for each other and building out even more of these community support systems in ways that I feel like we hadn't been seeing for a while.
yes. And I know we're talking a lot about food, but it's more than food.
right.
Elections have consequences. Elections have consequences, and we're about to see it. And not only when we're talking about food insecurity, We're talking about health. We're talking about the environment. Orlando Robinson's on here that does a lot of environmental justice work. I mean, we're gonna feel it in our entire lives. Everything affects, just like your vote. It's affecting everything in your life. And so we just hope that this information was helpful to you all. Unless I saw Reverend Covington, you haven't, does NBN have a story to tell right quick before we go off, or anyone else would like to share on the call before we close out?
Good evening. Thank you, Ms. Linda Sutton, and thank you to Maria, facilitator. I do not have anything at this time. I think we are in the same space as everyone else, trying to maneuver with what we have. But I think that we have power in our numbers when we come collectively united for the greater good of the people. So we just have to get back to work, roll up our sleeves, and
That's right.
that's what it is.
That's right.
Thank you so much.
That's right. Thank you so much. I knew you had some encouraging words for us. You
Thank you.
always do. Thank you so
Thank you.
much. Anyone else? Yes, this was excellent, Maria. Thank you so
Thank you.
very much for agreeing to do this. This information is it needs to get into the hands of a lot of other folks too, So
Yeah.
please feel
share
free
it
to
out.
share the information. You can share everything that you've heard. Yes, James, I see your hand.
Okay, so I missed like the first half of the presentation, so I'm kind of wondering, what is the NC Budget and Tax Center? I want to ask Maria. So
Yeah, so we're a nonprofit. We're a nonpartisan organization. And we do a lot of work to document and analyze fiscal economic conditions. And so I'll put it, and so we release a lot of research. We do a lot of data analysis about employment, labor conditions. I specifically work with our policy team to track at the legislature. We usually had only ever really done state work, but this year seeing the federal budget and the impacts it was going to have on the state budget, we expanded to do federal policy analysis as well of the budgets, and just thinking about how they're going to impact especially lower income, middle income people, and then offering solutions or alternatives for lawmakers to create systems that just work for people that need it the most instead of the richest or the top 1%, which is usually what our tax or economic policies focus on.
all right, thanks.
Great, thank you. So hopefully you've been keeping up with our chat, because Vicki has some good remarks. Cuts in science research and social service grants to counties will affect vaccines, research, and salaries of many state and county employees. So thank you, Vicki, for that. Anyone else? I don't want to keep you on here all night. We try to say 1 hour from 6 to 7. When I started out in this advocacy work, I started out in the labor movement, and my union rep used to say, "Start on time, end on time." Okay, and so Cheryl, she left. And so I try to do that. A lot of times the conversation is, it was so good, you can't help it. But we have 2 hands up, Ruth and Lisa, and I don't remember which one was first. So go right ahead.
Well, this is Ruth, and I'm going to be very short and sweet. I just want to thank you all for this. Was very, very informative. We've got a lot of work to do. Linda probably does not remember me, but she and I have worked on some projects before.
Yes, I do. I do.
And
Yes, ma'am.
and I'm looking forward to doing the work. We need to get our people involved, and we need to educate, and that's one of the things that we have been working hard, and we need to continue to work hard, is getting our people educated. This is affecting everybody, and a lot of people don't understand that this is affecting everybody. But again, I'm gonna be short and sweet, and Linda, I will talk with you again soon. But thank you all so very much, and I am really thankful that I was able to get on this call. But I always look forward to being involved. Thank you all.
Thank you. Well, Ms. Webb, we're so glad that you came on. Yes, it's been a while, but we've got to catch up. Okay,
Yes,
Lisa.
ma'am. Yes,
Lisa,
ma'am.
we can't hear you, Lisa.
I'm trying to come off of mute. Thank you.
Okay.
Oh, what a fabulous session. I just absolutely enjoyed everything. I know everybody's going to get the handouts. We're going to get all the wonderful links. We've got a call for action. We've got so much more stuff with Democracy North Carolina as it relates to getting involved. Please, if it's anything that you've seen today, share it, share it, share it. I'm Lisa Harris. I'm the regional organizer under Linda Sutton. And thank you for everybody who joined us tonight. Thank you so much.